I especially want women to watch this video. Awareness of heart attacks among women in our society is very low. There are a lot of inappropriate visits to the emergency room. Women are unable to recognize heart attacks, watch and learn the symptoms of a heart attack. Before I explain the heart attack symptoms that we see more often in women, I want you to know this. Whether it's a woman or a man, the most common symptom of a heart attack is always chest pain. Pressure, tightness, or burning in the chest can radiate to the left arm, jaw, abdomen, or back. This is primarily a symptom of a heart attack. This is also the most common symptom we see in women. But in women, this typical complaint may not be present. There may be other symptoms as well. The first of these is sudden onset shortness of breath, sudden difficulty breathing, or a feeling of not being able to breathe. Even without any other complaints, this should primarily make us think of a heart attack in women. Once a heart attack has been ruled out, other causes can be considered. A sudden onset feeling of not being able to breathe, something you've never experienced before. If you can't breathe, if you feel shortness of breath, and these symptoms last longer than 15 or 20 minutes, the first thing that should come to mind is a heart attack. Another symptom we frequently see in women that suggests a heart attack is dizziness, a sudden feeling of almost fainting, dimming of vision. In other words, a sensation as if your blood pressure is dropping. This could be a sign of a heart attack. I know many of you have felt this. I know what I'm saying might make you a little anxious. I'm aware of that. But we are really very tired of women coming to us late because of heart attacks. Women truly cannot recognize a heart attack and end up going to the emergency room late. That's why, in women, sudden onset dizziness, feeling like you're about to faint, dimming of vision, in other words, sensations that can be confused with low blood pressure, can actually be a sign of a heart attack. If these symptoms start suddenly and escalate quickly, a heart attack should be considered. We said that a woman's heart is different. We said that women experience heart attacks differently. Another heart attack symptom we frequently see in women is nausea and vomiting. No chest pain, no dizziness, no blackout, no pain, no tightness, but sudden onset of nausea and vomiting. This could be a sign of a heart attack. Even when working in the emergency room, heart attack symptoms in women can truly surprise us. Heart attacks can occur in people we would never expect. That's why these symptoms are important. Especially in women and also in the elderly, we often see a symptom that can indicate a heart attack, sudden cold sweating. A sudden feeling of cold sweat can be a sign of a heart attack, especially in the elderly and in people with diabetes, because these people may not feel pain. It may present more as cold sweating. This situation can also occur in women. Sudden onset of cold sweating, symptoms that can be confused with a feeling of low blood pressure, can actually be a sign of a heart attack. Other symptoms of a heart attack in women include pain on the right side of the chest. We usually expect pain on the left side, but in women, pain can also occur on the right side. There may be pain in the right arm, abdominal pain, back pain, or even just a headache. In other words, women should be more attentive to symptoms that start suddenly and escalate quickly in their bodies. Symptoms that can be mistaken for a panic attack can sometimes actually be a heart attack. Sometimes a heart attack in a person can be mistaken for a panic attack. I realize that you are watching this video with a bit of anxiety. While watching this video, you might be thinking, what if I had a heart attack too? I feel like I can hear you saying that and I'm aware of it. But if you have these symptoms, if they start suddenly, if you've never experienced these symptoms before, and if they escalate quickly, the first thing that should come to mind is a heart attack. I'd like to summarize my video. Men have heart attacks more frequently, but heart attacks are riskier in women. Heart attacks are more fatal in women. Keep these symptoms in mind as a summary. Chest pain. Yes, chest pain is more common in men, but it can also occur in women. Pain on the right side, sudden onset of nausea, vomiting, sudden onset of abdominal pain, sudden cold sweats, feeling unable to take a deep breath, dizziness and feeling faint, which are symptoms that can be confused with low blood pressure, sudden onset of shortness of breath, which can also be mistaken for a panic attack. If you are female and you experience these sudden and rapidly escalating symptoms, a heart attack should be considered first until proven otherwise. A heart attack should be investigated first. After ruling out a heart attack, other causes can be considered. These symptoms are important. Please save this video and watch it again. Please keep this video in mind. If you are a woman over 40, please keep these symptoms in mind. You should be able to recognize a sudden onset heart attack, otherwise it can be much more dangerous. Don't forget to subscribe to our channel and turn on notifications.